Welcome to our first virtual education session of the season with your new crew. I'm Stevie J. I'm the current colorectal fellow at UAB, and I joined the leadership team along with Gabby Donbeck, who's also on, Kat Lee, and then Hyundai. So today we're just going to do just tips, tricks, and how to be successful in fellowship. We have an awesome panel that's signed up for today. So if we're just going to start with some introductions, I'm just going to go in the order that you guys are on my screen. And then if you are not on the panel, if you could turn off your videos, that would be awesome. Okay, so let's start with Meredith.
Sure. I'm Meredith Genesi. I did my fellowship at the Cleveland Clinic, Florida, and I am currently in North Carolina. I'm going to start work for UNC Rex.
Awesome. And then Courtney.
Hi, I'm Courtney Devon. I just finished my fellowship at Emory in Atlanta, and I'm staying on as faculty here.
Awesome. Is it Asia?
Yeah, it's Asia Afsane. Just finished at Mayo and Rochester, and I'm going into private practice in San Jose.
Awesome. And Jill?
I just finished my fellowship at University of Minnesota, and I will be going to Kaiser in Los Angeles.
And then we have Adam also.
Hey guys, I'm Adam Shelato. I did my fellowship at Mount Sinai. Then I'm currently moving back to California, where I'm going to be doing private practice in Ventura, California.
All right. So the first thing that I wanted to say is we're just going to kind of go around to the panel with a few questions for everybody. And then we have Gabby here that's going to be running the chats on both Zoom and Surgeon. So any questions that you guys have for the panel, if you could post them there, and then I'll have Gabby help me read them to the panel. So with our introductions done, I guess I would love to hear you guys kind of say something that you wish you knew. I guess something that you wish you knew before you started. Kind of, hindsight's 2020. Let's start with that, and we'll go in the same order. So starting with Meredith.
Okay. Well, I think everybody always wish you knew attendings preferences beforehand, but I think generally it's not something I wish I knew as much as it's something I wish I did. It had been advice to me, and I started doing it towards the end of my fellowship, but I wish I had started way earlier, which is take notes on your cases, like take notes ahead of time about the background of the patient and the important learning factors, and then take notes copiously after the case, what are the ways that this person did it? How did they make the exposure easier? What did they use? I think that's kind of your basis for when you go into practice. You always think you're going to remember, but I've done a couple cases on my own where it's oh my gosh, how do we do this again? And it's something you've done a million times. So the more notes you take, I think is going to help you once you go out into practice.
Awesome.
I would echo what Meredith said. I think if you look, I have a stack of papers with all the random notes I took kind of throughout the thing. And so I just have to sort of piece that together for myself. But I think one thing I wish I did was to dedicate, I think, more time to actually studying and reading the textbook. We would do weekly chapters during my fellowship, which I think was helpful, but I think it's very easy to get caught up in a lot of the clinical side of things, both the patient management, prepping for cases, OR. And I think that I should have been better about carving out some time and saying, hey, we're reading this textbook, really devote that time to do it. Because it was something for me that I was let everything else kind of go ahead, research, etc. So that's one thing I would change.
Okay. And Asia?
Yeah, I think that start your job search earlier. I think this year we all went to the career course, and they were like, yeah, it's fine. Like, and people get their jobs later on in the spring. But I think that our year we didn't have, I don't know if you guys would agree with me, but it just didn't feel like that there were a lot of jobs. And so, especially coming in later on into the job search, having been reassured that that would be fine, it was a little bit of, it was a little annoying. So I think that, start looking early. You don't necessarily have to, set up a bunch of interviews early on, which I know some of the people in our year did, but start looking.
I think I'm next. I would definitely echo everything everyone said. And then just a slight spin on what Courtney said. I think definitely, like, if you can spend that time reading the textbook, but what I wish I would have known at the beginning, I think, was just how much time all the clinical stuff would take. I also thought, like, oh, I'll have plenty of time to read every single textbook chapter, every seminal research paper that, like, I have on my reading list, and that absolutely did not happen. So just like going in with that expectation, like the clinical stuff is important, but like trying to make time for the textbook and, like, knowing those papers. But what I kind of ended up doing in the middle of fellowship, when I realized, like, oh, I'm not going to have all the time I thought I would, is like I just made a list of like every textbook chapter, and like I took notes on the ones that I was able to read, and now I know which ones I didn't get to. And so just kind of keeping track of where you're at with, like, what you need to do when you're done with fellowship and you don't have the clinical responsibilities, like, when I'll be able to fill in those things, maybe during my time off, maybe during early attending life. But I think that was a good way for me to kind of be like, just acknowledge that it wasn't all going to get done, but have a list of where I'm at with textbook and research.
Okay. And Adam?
Yeah, I think I kind of wish that I knew or had a better idea of expectations for different attendings going into fellowship, because I think the expectations vary vastly between different attendings, and whether or not you're going to be observing cases early on versus actually participating in cases. And some attendings are better at letting you know expectations for what you're going to be able to do in the surgeries, and then after the surgeries in terms of post-operative care. I think asking attendings, I wish I had done that earlier, what my expectations were for certain surgeons.
Yeah, and just to kind of bounce off of that, I know personally I was very surprised getting like left alone for a long period of time, because I was like, wait, am I allowed to keep going? Am I allowed to keep operating? Am I supposed to wait for you to come back? I don't know, because nobody talked to me about it yet. But no, all of that is really useful and appreciate it. Just a couple of questions kind of to whoever wants to answer while we're waiting for some questions to get posted in the chats. And for those people that just joined, you can post questions to Zoom or to Surgeon, and then we can read them out to you. But I know one thing that I personally am having trouble with, would love to know how you guys handled it, is your transition from being a chief resident to being the fellow of a service. And like, I'm with a chief and juniors, and I have medical students, and I'm personally finding it really hard to not still try to do all the things I was doing as a chief resident. So I just love any kind of tips for stepping away or how you guys handled it.
I think honestly, I think that comes with time. I think in the beginning, you're in chief resident mode, and that's what you know how to do well, because you did it for 1 to 2, maybe 3 years, depending on how your residency was set up. And so I think embrace that in the beginning, because you're trying to find your way, you're trying to establish your reputation, you're trying to get to know the attending and their preferences. And then I think there's at some point, a few months in, or at least halfway through the year, you have to sort of say to yourself, yeah, I'm not going to know every single number about every single patient, and I'm still going to be able to figure out how to manage them, because you have to shift your focus elsewhere, whether it to be reading the chapters, knowing those articles, or like actually being like, hey, what am I doing for this patient in clinic? Like, let me pretend there's no attending here. How am I going to manage that? And you'll find that or at least I can't speak for yourself, but like I found for me, it was kind of a natural transition that just started to happen. But I had to say to myself, like, Courtney, just stop. Like, you can't know every I know, because it's not going to matter. Now, with that said, later on in the day between cases or whatever, I would go and like double check orders and look at all that stuff. But in terms of like prepping for like morning rounds, for instance, I made a conscious effort to say like, nope, you can quickly look at labs, you can quickly look at vitals, and then, you know, see if there are any major events, and then just step away from that chief resident role. My fellowship is such that I kind of serve more as a chief on the service because they don't have a chief with it. And so it kind of is by default, you sort of have to, but I really empowered the 2 and the 3 to sort of step up and take ownership and been like, hey, okay, what are you going to do? Like, okay, hey, what happened? And just, you'll find with time, you'll kind of be able to do it. And, but I think it's important to say to yourself, I am not a chief resident, I'm a fellow, because you still have to know stuff. I mean, depending on your attendings and what you have, I find the junior attendings I work with, some of them are still very in tune of exactly what's going on. And they're still, I think, doing that transition. And then I have very senior attendings and they're aware of all this stuff too. So I think it's like, I don't think all of a sudden you're a fellow and you're attending, you don't have to be aware of stuff. I think it's just a matter of figuring out how to do it within your sort of timeline, within your kind of workflow, so that it's not your primary thing, but it's still something that you know exactly kind of what's going on with the service.
Yeah, I would just building off of that. I think it depends on where you're at. You know, it depends on who's on your team. Like, do you just have an intern? Most of you probably will not be on a service with a chief, because usually ACGME doesn't like let that happen. So you still will have to do the same sort of things that you would have done as a chief, which is check what the interns are doing and make sure that everything gets done. You just don't need to personally do all of those things. Where I was at, it was pretty set. Like, you're operating all day, so the intern is going to be the one who's doing all the orders. So it's just your job between cases to make sure that they did that, and you'll learn pretty quickly like who can be relied upon to have everything done already, and who you'll need to be like, hey, just remember, like, this needs to happen. And some of you will also have APPs and other members of the team, so you'll know how to integrate them. I would say that the biggest transition to like, what's the difference between a chief and a fellow, is that you really have to take ownership of your patients. You have to put yourself in the position of, if this were my patient and I were the attending and I were in charge and I didn't have anyone to ask, what would I do for this patient? What would I want to do? And you're going to be in that place, you know, at least midway through the year to the end of the year, where you know exactly what you want to do, you know, and you also kind of know what the attending you're working for, what their style is. So you might, you know, kind of defer because it's their patient, but still, like, you need to know, like, this is my patient. What do I want to do? What is my plan? What would I do in this situation? If no one was in the room with me, what would I say? So I think that's the biggest transition. That, and you're also in a great position that, you know, where you're at, you're the most knowledgeable person about colorectal other than your attending. So it gives you this huge, you know, kind of responsibility, but also opportunity to teach as well. Like, if you have a mid-level and a junior, you can really get them integrated on their level. And that's maybe not something you're going to do in the first month of fellowship. But I remember towards the second month, like, we have one of our attendings that just really likes to pimp on rounds. That's like his thing. And he likes to pimp the medical students, which is hard because medical students are all over the place about how their knowledge. But like, you can really get to your team about appropriate level questions. What should they know for their ab site? And they're going to appreciate that. I like got to the point where, like, one day on rounds, I'm like, we're going to sit down and talk about anal cancer, because I'm really tired of going through rounds and you guys getting these questions wrong. That, you know, like, I remember it being super confusing. So this is how I can tell you, you know, how to think about this. And like, I think they were really appreciative of that. And because of that, they were like, you need to do our ab site review, because this was really helpful. So, you know, you also have the opportunity to teach while you're the fellow, which is great. And even while you're learning, you can teach, like, oh yeah, I didn't learn this until just now, but you guys, this is this really interesting fact that I discovered, or this really interesting paper that, you know, has changed the management of colorectal. And you guys, it's one of the seminal papers. You guys should kind of know about it, because you might be asked. So.
Oh, I think you're muted.
Technology. Anyone else want to comment? Otherwise, I have some questions coming in. No.
No, I think it depends on what type of program you're in, because I was part of a team that had chief residents, so my job was really superfluous, and I quite easily fell into that role of being superfluous. So you do have to kind of find your role within the team. And mine was a little bit kind of to the side. I would round on the patients I would operate on. I would, text the attendings, but I would really let the chief resident run the service, because I feel like that's their role. That's, where their time to shine is. And that's, you have to teach them that kind of position that they're going to be in. So I would let the chief resident really run the service. So I think it depends on where you're at.
Yeah, I would second that. At, our program, the floor was run by APPs and you didn't have a team. You were the team, and the APP carried the pager and put in the orders until 4 p.m. So I think it's going to really depend on where you are, and you kind of have to adjust your expectations and learn how the system runs and learn how much you can trust. Like, I started out with the APPs sort of being a lot more close, sort of in terms of management, and in the same way that you would with interns, where you're like, did this get done? Did the labs come back? And then once I got used to, once I understood that they kind of knew what they were doing, then I pulled back and I just checked in the afternoon and saw how the patients were doing and sort of let them run the show. Also because they would just do whatever they wanted anyway. So you really have to kind of adjust based on where you are. So I agree with Adam.
Yeah, I guess I'll say a similar thing at my program. It was like 80% of the time we were in private practice with attendings and APPs, and then 1/5 of the time we're at the university with just an intern, an APP, and occasionally an R3 on the team. And I'll just say, like, in general, I think you just have to be adaptable, kind of like Asya said, like just kind of read your environment, read your attendings, figure out kind of what it is they're looking for in you. Like on a team with just an intern at the university, especially in July with a brand new intern, like I basically had to be a chief resident again, and like, and the R3 and the intern as well. So it just really depends on like the time of year, what your attendings expect, and who's on your team. And I think in a lot of these fellowship programs, I think when you're working with multiple attendings or multiple different places, you really just have to kind of like pay attention, read your environment, and just be adaptable and not be super set in your ways. I think that kind of hurts you if you're like, well, this is how I always do it. Like, well, we always had this type of pain control. Just like drop that. Like, you can do what you want when you're in attending, but I think fellowship is not necessarily about like, winning the battle on how to manage your post-op patients, but just, learning and kind of getting along and getting as much out of it while still keeping patients safe.
Awesome. That's all really good advice. Another question is, I think, all about time management with your duties for your fellowship, whether it's case prep, preparing for MDC, and studying and preparing for oral boards. And like you said, reading the textbook, reading these papers, like what did any of you have a system for that? Or how did you guys kind of find the balance of when to do all of these things that are expected of you? Whoever wants it.
I think the hardest time is when you're trying to study for oral boards for general surgery. And that, I had a schedule for that, or I tried to keep myself to a schedule for that and then balance the rest. But, the remainder of the year, I don't know, it's not that bad of a transition from being, or at least it wasn't for me, from being a chief resident to this year. But definitely studying for oral boards was hard, and it takes a conscious effort because it's horrible and hard to get home at 8 p.m. and try to, study or watch the videos. But if you keep to a schedule, you find time, whether it's the commute, to listen to Behind the Knife or whatever. You just have to keep to a somewhat of a schedule and study for a couple weeks or a couple months.
Would you mind just giving an example of what that schedule looked like for you?
Sure. I mean, I would try to, I would try to do because I was in New York, so it's like on my way to work, I would listen to Behind the Knife, and then like when I would get home from work, like at least 3 times a week, I would try to read a little bit for oral boards. Yeah, I think, and then on the weekends, you have a couple hours here and there.
Okay.
Yeah, I think that definitely working and studying for oral boards is really challenging. Maybe that's a topic in itself. We'll just talk about it now. I agree. I did the Behind the Knife podcast on all of my commutes, and we do a lot of driving. So I started that maybe like 2 months before my oral boards, and just got through like almost all of those. And then I took a couple days of vacation time. Not right before my oral boards, but like I think 2 weeks before, and just like crammed, and I like watched the Osler thing, and I like looked things up along the way, and practiced with co-fellows. And then it was like a really busy week on call right before the oral board, so I kind of had that like delay, like studying a little ahead of time, which I think turned out fine. It was a little nerve-wracking. And then in terms of the rest of the year, I think I just kind of mentioned before, just like making a list of the things you want to get through and getting through them when you can. I did feel like it was always like, okay, one day at a time, like prepare for the cases for the week, prepare for your education time, like, for the next week. And then whatever leftover time I had, I would kind of tackle that list of like textbook chapters or papers.
Okay. Does anyone else have comments for that, Meredith?
I
Or
would say,
Andrea?
like, I wish I had a better system, but I think that what was helpful at the beginning of the year is, the year kind of goes through stages, and knowing that helps you plan. So like the first month or two is, getting your feet under you, and like, trying to survive and figure out how this hospital system works, and where the bathrooms are, and what this attending's preferences are, that's going to be a lot, and it's going to be stressful and transitioning. So that's kind of the next month. Then like the next phase is going to be oral boards if you take it in the fall, or it's going to be the like absite equivalent car site is in the fall. So it's going to be like one of those two. I know a lot of my co-chiefs did not care that much about car site because it's not valuable for anything and nobody really looks at it. So they were more studied for oral boards at that time. But it's that, period. And then the career course falls into that. And then after that, you really have to kind of start buckling down and looking for a job. And then towards the end, it's going to be preparing for, what also falls in that fall, time slot is getting your research done. And that may be something you should do in between, surviving the first month, and you're studying for oral boards is going to be getting your project in for ASCRS. But then, you enter this long period of looking for a job, and the kind of multi phases of that. And then the last couple months are preparing to be in practice. So like, stealing your attending's preference cards, and, figuring out how you want to do things and what instruments you like, and, really starting to hopefully take the reins depending on, your attendings and how much they let you do. So but I think thinking of it in that way, as in stages, you just have to like, this is what I should be focusing on this month, is helpful.
That is really helpful. Asya, did you have any comments?
Yeah, I was gonna say that because that fall chunk seemed really busy to me, like, getting in your abstract, I actually had a chapter due the same week as our abstract was due, and then, the car site. So that seemed just, in addition to sort of starting a new place, it seemed a little crushing. So I very specifically chose to take my oral boards in the spring, and that gave me December, January, part of February, February and part of March to, get into gear. And I would say I wish that I actually did start studying for real in December, because I think that would have made me less stressed out. I think everyone that I've talked to about this, we all thought we were going to fail oral boards. So just expect that you're going to think that you're not going to pass. And that's normal. And I thought that all the way through until I was, on the Zoom. And then once it started, I was like, oh no, it'll be fine. But yeah. But yeah, really deciding for yourself what chunk of the year you want to dedicate to each thing. So, which meant that, because I started my job search later, I sort of combined my December into job search / studying for roller boards. And that's why I didn't study for roller boards in December. So, being thoughtful about prioritizing, I totally agree with Meredith, prioritizing each sort of month for the thing that you feel is most important for that time.
I would also echo Asya. Every single person who has taken oral boards thought beforehand, I'm going to fail, like had a panic attack the day before thinking I'm going to fail. And also the advice I got was if you leave and you think I failed, that's also pretty normal. It used to be that oral boards were all taken at this, like it was like a 3-day event at a hotel in a certain city, and you'd all kind of go through it together. And so you could talk to people and be like, oh my God, I failed. And when you left, everybody saying the same thing made you feel a little bit better. But now because it's on the Zoom, it's much more convenient, but it is a little bit more isolating. So if you feel the day beforehand like you failed, totally normal. If you feel afterwards like you failed, that's pretty normal too. Don't go over it in your head. I mean, you can, if I did, you can if you want, like if you have to process it, but like, don't beat yourself up over it. Most people feel like they failed and most people don't. So, just remember that you're smart, you're prepared for this. Just go into it with a clear head.
And then again, for a bunch of people that have joined late, please post questions to the Zoom chat or to Surgeon. I can see the Zoom chat ones, and then Gabby is helping with the Surgeon. All right, so one question that just popped up is, how do you study for the car site? For, I guess, those of you that did study.
I have to admit, I did not study because my oral boards, I think, were the weekend. They were separated by like 1 day or 2 days. So I did not study.
I should clarify, I did study for car science. I had already taken my boards and passed, so I had a much easier time of it than my co-fellows, but like 3 out of my 4 co-fellows were taking it like the next day or something. And so like did not study for their car site. I think the same way, there's no like prescribed method like the ABSITE. I think one thing you can tell yourself is, again, nobody sees your score except you. It's really for you to know how, the pretend like this is what it's going to be like for your boards. But like, there's no prescribed study method like there is for ABSITE. But I think, reviewing the textbook and, going to meetings like this, I don't know that there's like kind of a background. I had a like background in colorectal, so like I like knew some stuff, but like do the online what are they called, the questions
One on like Ask Ours You.
No, those are good too, but there's ones that are specifically like that ASCRS provides, and our attendings gave us like some fellowships give you a membership to this, but it's like CARSEP. CARSEP, that's what it is. So it's just like CSAP except for the CARSEP.
Gotcha.
To do all of those questions. I know that like my fellowship, they just give you their login data, but some fellowships give you specific, like your own account. But basically in our meetings, we did a lot of the questions anyway, and then I just did the rest of them by myself. And it was kind of like going through a question bank for ABSITE.
Okay. And then couple questions about the job search and tips and tricks for the job search. When were you told to start for the job search? Where did you go to actually do the search? And then any other advice that you have for that process?
So I think for those of us who had been at the fellows conference, which I highly recommend everyone goes to if you're able to, I think it is really helpful just to be there and be with other fellows. And then the talks were all really great. If I remember correctly, they
Are
said,
you,
"Hey,
are you talking about the career course? Sorry,
the
Dan.
career, the
Okay.
fellows career course." Yep. And then I think that during that time, they're like, "Oh, don't worry, jobs don't really get posted till like January, February, stuff will happen around that time. It's okay if you apply and never hear from anyone. That's totally normal, but all of you will get jobs and it will be okay." And that is true that all of us will get jobs and it will be okay. But I think the process was maybe a bit more challenging this year with COVID and the impact that has had on hospital budgets. I know specifically for academic positions, which is what I have been looking at, a lot of hospitals don't have the budget for hiring new people. And if they did, they weren't getting the budgets finalized until later on. So the jobs I think that people were looking at originally in like January, February were not really popping up until March, April, and kind of past that point. So I think for many of us, it was sort of like, are we going to be unemployed at the end of this, et cetera? So I think stuff kind of just was a lot slower and later. And I think with that, the jobs were posted later. The places I found jobs were from the AskOurs job board. You can sign up to get notifications emailed to you when new jobs are posted. With that said, I found it was kind of sporadic and I would just look at the job board myself. American College of Surgeons also has a job board. I would sign up for notifications for that. But again, they were kind of sporadic when you get those emails. So I would look at that. And then I stumbled upon LinkedIn, and maybe it's me that just didn't know, but LinkedIn actually ended up having jobs on there that were not posted on either AACS or AskOurs job board. So that was another spot where I was able to find jobs. If there are places you're specifically looking at, and I'll speak again from an academic standpoint, then you can just go to their website and see if they have anything posted on the job board. If you have connections to anyone, you can reach out and say, "Hey, I'm looking to come to this area. If a job comes up, let me know." I think that's all valid. My program director is on different listservs. So as stuff would pop up, she would forward them to me as well. And then if you're, any of the attendings in your program are connected to any location that you might be interested in some way.
Oh, you're breaking up a little there.
Sorry.
That's okay. We just missed the last sentence or so that you said.
Oh, I was just saying that if your attendings have any connections to places where you want to go, having them reach out on your behalf is also really helpful to do.
Yeah, I would say I agree with everything you said basically, but I think job search kind of has a timeline. And I think one of the things I agree with the fellows course being super helpful. And I think one of the things that it is most helpful for is it helps you clarify what you want. Do you want to go academic? Do you want to do private practice? What do you want your percentage to be? What do you want? Do you want to teach? Do you want to do research? Do you want to what do you want from your career? And what do you want, early on? Do you want to do robotics? Do you want to do that? So I think it was very helpful for that. I think in terms of timeline, I, kind of put it off a little bit. And I'm like, I'm not even going to start looking till the career course. And then at the career course, people already had jobs. And I was like, why are you even here? But I think majority of people did not have jobs and they were very much like, oh, it's fine. You can stop, you don't need to worry. But I think that the timeline for this that you should kind of think about, and I don't know, I'm speaking to my own experience, but I think that was kind of helpful. You might want to start earlier, you might want to start later. But the career course is the first weekend in November or so. And I didn't start looking until then. Some people said they started looking in October, but I don't think that there's not a lot of jobs posting. They kind of have a season, a up and down kind of swing. And so I don't know that it would have been better if I'd started in October. And then in November, after the career course, I again kind of was like, oh no, I don't need to start looking yet. But I did. I tried to spend November really focusing on what I want. And I think you'll get a lot more out of the job search if you do that first before you just willy-nilly start applying for stuff. So I think I spent November kind of working on my CV. Dr. Emily Steinhagen, has a really good podcast that I listen to about writing your CV to the employer, which I think was very, very helpful. She didn't do the talk at the career course, and I thought she was going to. It's very sad. But anyway, I would listen to that podcast and really kind of try and tailor your CV to the job that you want. Same thing with your cover letter, which honestly didn't really realize was a thing until I went to the career course, which is kind of sad, but how to write a cover letter is really addressed well on the internet, and going to the career course and kind of reflecting helped me really write a strong cover letter that wasn't too long and wasn't too, was just kind of right for me. So I spent kind of November kind of in self-reflection and getting everything perfect. And I think I started applying for jobs at the end of November, early December. I didn't really start hearing back from places until like the end of December, early January, and then interviewed in like March or so. But I would echo the fact that, so first of all, I definitely think that there have been less jobs in the era of COVID because of budgets and budgets being tight. I think one other thing I did was talk to people who had gotten jobs last year, which I think was very helpful. And because they were all like, oh, it's really hard to find a job, and it happened much later. Like a lot of people I saw at ASCRS last year still didn't have a job. And so I expected it to be a lot harder. Actually, I had a kind of like a negative mindset going in, and so it wasn't that bad. But I would say, starting earlier can help. But I would also echo the academic versus private practice. It used to be, they told us at the career course, like all the academic jobs pretty much get posted in January because that's when their budget is finalized and when they start to know. There was like nothing in January. If you wanted to do academics, it was like March, April, May before you were even seeing the jobs posted. So knowing that early on is pretty important because, and I was not alone. Other people, other of my co-fellows were experiencing that, where they were like maybe getting a job offer from a private practice, who could offer you a job early in the year, and having to decide, is this what I really want? Because private practice picks their own schedule. And so it's a lot sooner. So they might be offering you a job earlier, and academics, you may really have to wait for. So if you really are invested in that, just know that you might have to wait later into the year to hear from that.
I think, Asya, did you say you were going into private practice?
Yes.
Cool.
And I agree with Meredith that it's important to do your soul searching early, because I certainly waffled for a long time. And part of my decision was that I didn't find an academic job that really like suited my needs. And I think that had I started looking in October, which some of my friends had, and had started interviewing in like December, I could have, gone in a different path. And like, I am very happy with the setup that, I'm going into now, but, certainly my life could have been very different, had I started looking earlier. So I definitely think that it's a good idea. I think that the sites, the ASCRS job board, there's a New England Journal of Medicine surgery job board, there's a JAMA surgery job board, Indeed.com. Like, you have to know that the all those like big job boards, they have to pay to put a posting up. So places that are smaller, or maybe not as invested in sort of their search, not as like urgent in their search, will post it on places like Indeed.com and I forget which ones, but kind of like things that you wouldn't think about that are mostly targeted to like IT people and tech people. Those have plenty of job postings for surgeons also. So you kind of have to look. I will say that. But yeah, definitely do your soul searching and decide what are important factors for you in your future. Yeah.
I would agree with that. I think the ASCRS, so it's like facrs.org/careers is the I know because I went to that site many, many times, but anyway, that's the job post for ASCRS. That's great. It has majority of the colorectal jobs. It isn't specific to colorectal, so you'll see a lot of like transplant jobs for some reason or other jobs, surgery jobs. But I think that's great. That's a great place to start, especially early on. But also that everybody is looking on that site. Every fellow in colorectal is going to be looking on that site. So you're probably applying to somewhere that many people are applying to. That's where I found my job. But I think that I agree. Indeed, for some reason, this year had a lot of jobs before they were even posted to other places. I looked on Practice Link. I didn't see Indeed until much later because I didn't think it was for surgeons, but they had a lot of jobs this year. But I would also echo that I think a lot of people end up finding their jobs by word of mouth sometimes. And even if it's posted, you're going to get the in on it before it's posted or before they really start interviewing. So really like look to your mentors, look to, the people in your program. I think your program director will probably forward you all the things that they get. But like, I went to a place that had a huge alumni network, and I think that was super helpful because, even after I was like interviewing, they could be like, oh, I know so-and-so, I can talk to them. So I think, but not everybody is like that. So, but utilize the people, because a lot of colorectal it's a small field. People know each other. So if you really want this job or, or whatever, then use the people, or even if you're like, I'm really struggling, do you know anybody who's looking? A lot of people are like, oh yeah, I heard of this job. So it might come in weird places. So you really want to like, depending on where you're at, you really want to kind of utilize people as a network.
And how much time off would you guys say that you needed for interviews? Like how many vacation days did you guys have to use as people are trying to figure out their schedules?
So a lot of, and again, I'll speak for the academic side, a lot of it, there's initial interviews that most places are doing on Zoom. So it's kind of the initial like meet and greet. And then from that point, they ask you or invite you to go in person. And for each of those, my experience had been there's a dinner either the night before and then you have a full day of interviews, or there's a full day of interviews and then a dinner that night. But I think you should expect to have at least a full day off and then potentially a travel day or half a day. So I would fly out take a half day in the morning, be at clinic or cases and then leave so that I could get to dinner the night before and then fly back the next day after the day of interviews. So it just depends on how flexible your program is and kind of supporting it. I mean, keep in mind, they want you to have a job. So it's one of those things that my program wasn't requiring me like, oh, you had to bank this number of vacation days to be able to do it. It was more like, you need a job, so you should be going on all of these interviews is kind of how it was, my experience.
And then another comment on vacations. It sounds like some people took some time off for oral boards, either before or a kind of around that time period. And then for interviews, did anybody not take like a full week or so? Or I'm assuming everybody does.
No,
I think I like
oh,
took
sorry, go
2
ahead,
days off for oral board. Sorry. For oral boards, I took a Friday and a Monday, and then I guess the Tuesday that I took the oral boards on. And then I didn't take any time off for interviews because I was doing it kind of remotely because I knew I was gonna come back to California from New York.
Okay.
Yeah, I took the Friday before off, then I had the weekend, and then I took it on a Monday. So I didn't take any other time off for it.
Okay.
And then in terms of jobs, so Kaiser is like a very specific West Coast sort of thing, but I found my job like pretty early on. I think the Kaiser jobs like have to be posted, and there's specific websites for like each region. And so I just signed up for, the job search websites for Kaiser Northern California and Southern California. And it's a pretty like official process. Like you submit your letters of rec, you submit your CV, and but I think what helped was, telling my mentors that this was a job that I really wanted, and like they happen to know people, in that system or kind of at surrounding Kaisers. So I do think that like using your network and talking to your program director early is really helpful. For me, it was a little different because I left my husband and kids in California, and so I like knew that I had to come back, and so that's why I looked really, really early. And it felt really weird to like ask my program director for a letter of rec like week 1, but like was said before, they want you to have a job, and everyone's really supportive. So yeah, for people looking into a Kaiser job, I would just say, just look on the Kaiser websites, like reach out to the recruiters for each region. And, I think that was definitely helpful for me.
Okay, and then a little, not really little, much off topic. How, if at all, did you guys change the way that you prepared for cases compared to during residency? And it's okay if you didn't.
Well,
One thing,
sorry, go ahead.
go ahead. One thing that one of my attendings did, which I really liked, was before sort of early on, we would write out all the steps to the case on a whiteboard, and we would put in like whatever instruments you need for like particular steps. So I thought that that was a really nice practice. It's actually something that I'm going to try to do in my own practice. And I didn't do that obviously with other attendings who didn't do that on their own, but I did sort of try to go through it on a piece of paper or in my mind. I thought that was a really nice practice because it lets everybody in the room know like where you are in your step-by-step process. And like, there's no questions like, yeah, we do need a vessel sealer for this case, it's on the board, even though we verbally told people too, but it
Oh,
was just
on the
really
whiteboard
nice.
in the operating room.
Correct.
Oh,
Yeah.
that's awesome.
Yeah. So yeah, I thought that was a nice practice, and I'm going to be doing that in my own practice.
Yeah, I totally agree. I think that in residency, you prepared for the case by reading about the case and reading about the patient and thinking about the steps of operation. But in fellowship, you're doing cases you've done before, you're doing a lot of the same cases, but you're getting a lot better at it. So it's a lot different. You have to, I agree. I had an attending who would make me verbalize every single step of the case and what instruments I would need. And so like, if we got in a case and we didn't have the ligature, be like, why didn't you store a ligature? So like because when you're on your own, you're going to have to ask for all of those things, every single thing you want. And yeah, you'll have cases where you're like, oh yeah, I forgot I need this. And then you'll have to wait for it. But it's a lot easier as time goes on, the more you can visualize the case ahead of time and think about every single step that you want to take. And what instruments you need for every step. And so I think that as you progress through fellowship, it becomes a lot more about visualizing the case. So it was a lot less, yeah, I would go through the history and things like that. But, I know how to do a right colectomy. What I'm going to do is go through the patient's imaging. I'm going to go through their CT, and I'm going to visualize the case and also visualize what their abdomen is probably going to look like based on their past surgical history or what this tumor looks like or whatever. I'm going to imagine every step and where the pitfalls are going to be or where I'm going to struggle or where I struggled last case. So it's a lot more imagining and preparing visually for the case. And then even afterwards, going over like, where did I struggle and what could I have done better?
And then along the lines of cases, any tips for logging as all of us are like just getting access to it, or things that we should remember, or things that you guys had trouble with at the beginning?
Log every week. I remember as a resident, I was terrible at logging, but as a fellow, I got reminders like little nastograms from MedHub that I hadn't logged my hours if I didn't log them every week. So every Saturday I logged my hours, then I'd log my cases. And I didn't do it as religiously as I should, but I think that that is very helpful. That way you don't forget. And that way towards the end of the year, you know exactly where you stand. I will say in terms of tips and tricks, it is a little bit different for fellowship because you have to log the disease code too that's associated with the procedure you're doing. And there are certain disease codes and there are certain procedures that are going to be a little bit more challenging to find depending on which program you're at. You know, if you have a huge center for inherited bowel diseases, you're not, or inherited cancer syndromes, you're not going to have trouble with that, but most places don't have that. And so like, that's something like if you talk to a single person who has FAP, make sure you log that immediately or you're going to forget about it, or at least know which patient that was so you can go back and log it. I think the other thing, pelvic floor, those things like, did you read the manometry? You can log that. You can and associate with that with a code, and you need to log all of that stuff. You also need to log all the endoscopy you do, which there's no way I logged every endoscopy I did, but I started logging halfway through the year because I realized I had 0. And of course, there's no way I did 0 endoscopy. I just didn't log it. So there are certain things that are a little bit challenging to get depending on your program. And so you can ask your program director, he'll be able to tell you exactly what is hard for people to get or what people were short on towards the end of the year. It's not always what you think it's going to be. Like again, it depends, it's program dependent, but I got a whole bunch of pouches like right off the bat, but then at the end of the year was like short on transanal excisions for some reason. And it's because I was logging things wrong. So.
Yeah, I was very good at logging in residency and was pretty horrible as a fellow. And I don't know if, again, I just don't know if it was the timing or the case thing. But one thing I found that was helpful so that I didn't get into the situation where I didn't have stuff that I know I had done is if you go to one of the drop down menus, it's called the index category, and use that to log your cases. Cause that's going to be what has the way, cause you could say, oh, I was logging all these rectal cancer cases. And then you go and you run your category minimums and you're like, I've done no rectal cancer. And that's just not true. And so if you go back to like the index category drop down and select one of those, I actually found that was helpful. And so my tips on that would be to just periodically run the report for your case minimums to see where you're at and say, hey, am I around where I think I am, or am I actually just logging stuff wrong and I don't know? You don't want to get 3/4 of the way through the year and have to go back and relog stuff. It also can help you see if you're on track to meet stuff. Like similar to Meredith, like I had all my pouches in September. The fellow the year before me here, it's not that Emory is a huge pouch center, but the fellow the year before, he didn't get all his pouches until June. So it was one of those things that they have been stressed about pouches for me coming into it, but I got them pretty early. And then there was a couple other things that just were just harder to get. And it's again, just kind of sort of how the volume does. So I think one tip, or I guess this would go to your first question, CJ, on the what I knew before is just being a little bit more on top of my case log and know I'm where I'm at to be sure that I'm getting all the things that I need and it's not a scramble to the end, and not because I don't have the volume, but because I just didn't log it correctly.
Yeah, transanal excisions, make sure you log that. So like if you removed a polyp from someone's bottom, you know, during an EUA, that's considered a transanal excision. Anytime you do an EUA, you are doing anoscopy at that time. So log anoscopy for that. Yeah, I totally agree. When you see a clinic patient with Lynch, or you round on somebody else's patient in the hospital because you're covering and they have, you know, Lynch or FIP, that log that as your hereditary cancer syndrome patient. Ostomy complications, if you're doing a peristomal hernia repair or you're taking down a stoma that had a peristomal, like a little tiny peristomal hernia, that's an ostomy complication. Disease code. And then this doesn't matter because you're going to get a whole bunch of stomas, but you know, when you're doing an LAR, that's not an automatic, like you have to log the stoma separate. You can log you know, you log 2 diseases and you can log 2 procedures for each time that you log something. So if you did an LAR with an ostomy, you know, code those separately. And sometimes, you know, if you did 2 things that are potentially useful for your log, then you just log them both for that patient. Unlike the general surgery coding, you and your fellows can all code the same case. So if you guys did a JPouch together, you can log it together. It turns out that if you do a cadaver case, you can log that. According to my corporate program director, who's the president of the Program Director Association. So I didn't ask questions. Those are my big tips. And just like when you see clinic patients, log those clinic patients as your like disease things. Just when you start, just log everything. And then by the time that you're mid-year, you're going to be done with a whole bunch of categories and you can sort of drop the, very strict coding. And then have like a specific time in the week. Like Meredith, you said you did it on Saturday. I think I did it like Wednesdays in the morning before my case started. I would log everything because on Thursdays our program director would send out our case numbers. So I wouldn't to like look like I actually did something that week.
And in our, sorry to cut you off there, because we're getting close to time. We have about 5 minutes left, and I guess I'll let you finish your thought, and then if we could just have your final pearl about your fellowship year, your last piece of advice, would be really appreciated.
Yeah, I mean, I don't think I have much more to say about coding, but I guess the biggest piece of advice is really prioritizing things for yourself, because at some point you realize that like you're this year's for you, and you're going to be doing the service things automatically and taking care of patients and doing all the things that you're supposed to be doing. But if you don't stop and think for a second, you're going to deprioritize the important things that are actually important for you. So like, for example, once I decided that I'm going into private practice, I asked for more anorectal cases because, they don't do a ton of anorectal at Mayo. Like once you're done with your 20 hemorrhectomies, you don't ever do an EUA again. So I was like, well, I actually want to do it and I need to do it and I like doing them. So I asked for more of that. I asked for more colonoscopies. So, you're going to have regular check-ins with your program director. I think they have to do it every quarter. So just voice what you need. First, you have to figure out what you need, and then you voice what you need to your program director and see if they can adjust.
I would agree with Asya. This year is for you. That's a great way to put it. So part of that is responsibility and self-reflection and being like, what am I good at? And what do I need more to be better at? Like if I need to be better at colonoscopy, or I'm pretty good at that, but I need to be better at, laparoscopic or robotic skills. You don't need to go to every big case if you feel good about that, but you need to be in anal rectal and vice versa. And some programs are going to be different about what they stress, but it's for you. You have to figure out what you need. But the flip side of that is, I would say it's for you. Enjoy it. This is a great year. It's a lot of fun. It's a huge year of personal and professional growth. And it goes by fast. And for me, it was a lot of fun. So, this is the first time you really get to focus on what you really enjoy. And so it's a great year. I would just enjoy it.
Courtney, you want to go next?
Yeah, I'd say the same. I wish you'd more original. The year is for you. I think I wish I'd probably done a little bit better at really prioritizing that, but just saying to yourself, hey, this is what I need to learn. This is what I need to know. This is what I want to be doing, I think is really important. And there's going to be stuff that you're going to have to do. And that's just the nature of being a trainee. You're not on your schedule, you're on everyone else's. And so I think trying to find little ways to make sure you're getting out of it what you want, because it is your kind of, I hope at least, your final year of training. So it's going to be what kind of solidifies things for you going into the next phase of things.
Adam?
Yeah, I would just say throughout the year, kind of pay attention about who you want to be like and write those things down in terms of steps of surgery, things that people use, little things about port placement. Just write it down, take pictures and record your videos. I started doing that towards the end of the year. Record your robotic cases, because especially stuff that's a little bit more uncommon, I think that'll help because when you're in practice, we're doing so many cases as a fellow, but when we're in practice, an APR or, a robotic transanal excision doesn't come around that often. So, how to place supports, how to position the patient, and then you can review that video in preparation for when you go into practice. I think that I can refer to those notes or those videos when the time comes.
Jill?
Yeah, I would echo what everyone said already. Definitely write things down after your cases. I didn't do that every time, but those little details that just like you're not even really thinking about when you're doing the case, because like the attending's, calling for the suture or the stapler or like whatever it is, just write things down so you have those notes for later. And then I also started thinking about like, who am I going to call next year, when I have a question, and just like, well, for this type of like for a pelvic floor issue, I'm gonna call this person. For this like acute care issue, like this person seems, like responsive and will be up at night. And just kind of like thinking about those things, I think just helps me feel more comfortable going into practice and knowing that, all of my attendings, I'll kind of know who to call when I'm in a tough situation.
That's really good advice. Looks like there's no other questions, but thank you guys for spending time with us tonight. I really appreciate it. I hope it eased everyone's first week of fellowship jitters. And we'll post the recording soon for anybody that missed it. And then if there's anything else, otherwise we're going to sign off for tonight.